Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great self-treatment exercise for those of you with spondylolisthesis of L5-S1 and L4-5. Hope you enjoy. So we all know that there are many treatments that you can incorporate to help with pain related to spondylolisthesis of L4-5 and L5-S1. These include soft tissue techniques, chiropractic manipulation, osteopathic intervention, physical therapy exercises, pain meds, and even surgery in severe cases. But what most don't realize is that there is a lot you can do on your own in terms of self-treatment with a targeted corrective exercise program. And we have several of these exercises shown on this channel, but we're going to go over today a very common base foundational exercise for lower spondylo of L4 through S1 that can really help to begin to reposition your body to help prevent that pressure that causes that spondylolisthesis vertebra from sliding forward on the vertebra underneath it or on the sacrum. Remember that spondylo is usually aggravated by excessive extension, and that is an increased arch of the lower back. Many people with spondylo have an anterior pelvic tilt posture where in standing position, as opposed to normal good posture where the pubic bone and tailbone are level, an anterior pelvic tilt posture exists where the tailbone is higher than the pubic bone. And that increases the arch of the lower back and mechanically drives more pressure of that vertebra forward, compressing the back of the facet joints, the disc fibers, and irritating many cases of spondylolisthesis pain. So this exercise is based on trying to decrease that arch and help to pull or check that vertebra that slid forward slightly backwards to ease that soft tissue irritation. And here's how we're going to do it. We're going to actually use two concepts combined to do this exercise. The first one is a posterior pelvic tilt. Now, again, if you take your hand, take your thumb for instance, and place it on the midline of your lower back, those are the bony knobs or spinous processes. You're going to do that at about belt level, which is about the L4-5 level, or slightly below that, the L5-S1 level. If you keep your thumb right in the center on those vertebrae, those bony knobs in the middle line of your back, you'll notice that if you tilt your tailbone under or pubic bone upwards, that's using your abdominal muscles to pull your pubic bone up and your hamstrings to tighten and pull your pelvis down, that's going to cause that vertebra to actually move backwards into your thumb. It's going to take the top of the sacrum, which is that triangular bone that your spine sits on, which is usually tilted forward in most cases of spondylo, and it's going to help to bring it backwards into your thumb, which is going to reduce the arch in your lower back, reduce the extension stress on your spondylo, and help to reduce pain just with that one maneuver. But we're going to add something to that, which is the second component of this exercise, which is we're going to use the lower fibers of the erector spinae muscles, the longissimus and iliocostalis, which the lumbar or lower back fibers of this muscle attach from the sacrum and pelvic bone up into the vertebra. The erector spinae in this level exert two pressures or two mechanical units of force on the lower back vertebra. They exert an extension force, which of course we don't want because that would aggravate a spondylo, but they also exert a retrolisthesis force where, because of their attachments, they can actually help check or pull the vertebra backwards, which helps prevent that forward mechanical irritation. And the way we separate the two functions of the muscle is we use the pelvic tilting, because if we didn't pelvic tilt and we fired the erector spinae, they would actually compress through extension as well as pull back. We don't want that. We just want the pullback function. So the way we highlight that is we maintain that tailbone under, that posterior pelvic tilt that we did in the first phase of this exercise. So if you keep your finger there, make sure that the tail is under to a comfortable degree. That's going to flatten the lower back or move the sacral base backwards, pull the vertebra backwards. And then we're going to tense, without moving, the tailbone back upwards as if we're trying to arch the back. But here's the key. We don't actually want to move it. We just want to tense it that way. The motion is tail under. That's safe. But if we tense it back upwards, back the other way without moving it, that's going to create a isometric contraction of the longissimus and the iliocostalis, the lumbar or lower back fibers, and that's going to help hold with tension that vertebra backwards. So if you put the two together, both a comfortable amount of tail under motion and a comfortable amount of tail up tension, you'll help hold that spondylo in a more correct position where it's not going to slide forward. Add to that any RPI or mechanical corrections that you've learned in our other videos. Remember, RPI is reverse posture isometric. That's learning your unique tendencies to either hip hike or rotate to one side or not have a multifidus muscle or oblique muscle dysfunction aggravate your spinal pains because of an asymmetrical force on your spine. If you have those all in check and corrected, that's only going to highlight the effectiveness of this or any healing exercise for spondylolisthesis. If you're not sure about what your RPI or your unique posture or mechanical issues are, go to either the Posture Size or the Pain Free and Fit websites. We have a free body analysis there. Take it, check it out, learn what your unique tendencies are. That's really going to help make the difference, because that makes now this exercise, like any of our exercises, tailored for your unique condition. If you like this video on posterior pelvic tilting and erector spinae contraction to help hold spondylolisthesis, feel free to subscribe to our channel. We got a lot of other great videos on it. Give me a thumbs up below if you'd like to help me share this vital information with others. And remember, if you're looking for a tailor-made custom exercise program for your own spondylo, go to the painfreeandfit.com website. We've got our fast-track healing exercise program for spondylo that has all the pain relief exercises, stretches, coordination exercises, strengthening, stability exercises, nutrition, all based on your unique analysis of your body. I hope that this exercise on pelvic tilting and erector spinae contraction helps you with your spondylolisthesis pain.